Welcome to Diagnosing the Barriers, a podcast by Physicians for Human Rights Israel. Through our conversations on this podcast, we explore aspects of the right to health and violations of this right, as well as other interrelated rights in the areas under Israeli control between the Jordan River and the Mediterranean Sea. I'm your host, Lee Caspi. Today, we're joined by Keren Shavit from PHRI's Occupied Palestinian Territory Department to discuss our principal demand for a medical evacuation corridor from Gaza to the Palestinian hospital network in the West Bank and East Jerusalem. Thank you for joining us, Keren.
Thank you. Hi.
Hello. So I think it would be helpful to our listeners if you could start us off with a brief update on the current situation in Gaza in terms of the availability of medical services and the healthcare system in general.
Well, I think it's really a great question and always relevant. I think it's great to start from a little bit evaluating what do we mean by the healthcare system. So just to understand what's happening on that side now. So, because I feel a lot of people, very naturally, when they hear about the healthcare, they imagine a hospital. When they hear the healthcare attack, it's the hospital being bombed, which is, of course, a part of it. But, it's very beneficial to understand that the healthcare system contains of so many parts. There are so many important segments and they need to exist all together in order to have the system functioning. For that instance, you have hospitals, of course, clinics, you have, the logistic parts, the warehouses, research facilities, labs, and all of these pieces have to function in order for the patient to at least to at last understand and get the health care. And right now, all of the branches are harmed and destroyed. And this is very, very important to understand. I'll give an example. Let's say if one needs a surgery, they need to have so many components, like the surgical theater should be clean, of course. The instruments should be all there. There have to be medicine, tools, all this stuff that's professionally trained. And very important post-surgical care. When you need the wound dressing, when you need all the medication, you need to go and have rehabilitation sometimes, especially since in Gaza there are so many trauma patients. So at this point, all the branches of the healthcare are being damaged. We know that there are still shortages of the medication, of the medical equipment. We know that there are a lot of problems with the diagnostic, with the care itself. And I would like to remind that the so-called ceasefire has been announced in October 25. We are now in the end of May 26. There are still shortages of basic things, as basic as sterile gauze. And I like to bring this as an example because it's such a basic part of the healthcare equipment. It's basically a piece of fabric that went through the process to eliminate all the bacteria. So it usually comes in a small packet. You open the packet, the moment the gauze meets the environment, it's compromised, right? So you need it sterile. And it's very, very important for the wound care at all the levels of the healthcare. This is so important. And I first heard from a healthcare worker in February that they have issues and they have troubles delivering this item to Gaza. And I kept on asking healthcare professionals and they told me, yeah, that's true. And sometimes they have enough of it for the first dressing. And then for the next dressing changes, they don't have sterile gauze anymore. They have to use the ordinary gauze. And it's very, very bad for the wound care. And patients still getting infections because of that. And in Gaza, it's especially problematic because they have an issue with antibiotic resistance. So some people develop superbacteria because of number of reasons. We'll not get into this right now. But that means that some antibiotics would not even work for them. And this is a big issue in Gaza.
Are all antibiotics even available if a patient needs them in that kind of situation?
As far as I understand, there are still a lot of issues with the antibiotics there. And also, it's very important to add that the treatment of the patients is a complex process. It's not just like, someone is sick, you give them a pill that's an antibiotic and they go home completely healed. The process is following. They have to get first the lab work to check which bacteria specifically is there. So that's the first step where they have a lot of issues because there are a lot of labs that didn't receive the equipment after the so-called ceasefire. And I know that in 2025, 24, they already had issues functioning. So still they didn't manage to rebuild a lot of this equipment. It's missing. So sometimes they don't have enough abilities to determine which exact bacteria is there. Then, you have to match the one or several antibiotics all together. And then you have to make sure that all of these antibiotics are available. So as far as I know, and a lot of doctors told me about it, that they had to use not even the second best option, sometimes the third or fourth or etc. Best option. Sometimes they couldn't check which bacteria is there, so they just had to use something, hoping that this is the right one. And so that's more or less to conclude how many steps are there to go wrong. So for some protocols, let's say you have several antibiotics that should be used in order to achieve the best treatment for this patient. So if you don't have one, or you don't have the full course of all the antibiotics, your treatment is already compromised.
I think this is a very useful illustrative example of how every step in the process of treating a patient who one component of the care they need is surgery could go wrong, and surgery may not even be all of the treatment that patient needs. If they are an oncological patient, they may also need, first of all, to undergo diagnostics that, as we know, are largely unavailable in Gaza at the moment in terms of the lack of availability of MRI machines and CT scanners. And then they may need a round of chemo or of radiation therapy. And I mean, it's helpful to zoom in and see how each step of the care that one single person needs might be unavailable or partially available or compromised. And thank you for that background. If you could still just say a few words, because I agree with you that a lot of the time the discourse is at the level of bombings of hospitals and the more dramatic events that we saw documented. But if you could say a few words about just the current status on that level in terms of functionality of hospitals, clinics. I understand the need to look at the system as a whole, but has there been any rebuilding of the damage that has been caused on the physical level of the facilities?
Well, as far as I understand, some of the partners and humanitarian organizations, they're trying their best. There is nothing to say against it. But the problem is not the physical building, it's everything that comes with it, And first of all, when we're speaking about the supplies, you can't just bring a lot of trucks of different types of medication and, call it the rebuilding of the system. Again, I'm always trying to be very careful here. I think that we should be so grateful for every single enterprise and every single, humanitarian worker, because this is really difficult conditions now. The Israeli system right now doesn't allow the rehabilitation of practically any civilian infrastructure in Gaza. And I think that in order to rebuild it, it's very clear, and we're also, as PHRI, we're trying to empathize on that. You need the restocking. You need to bring everything at once. You need to fix the equipment. As you mentioned very correctly, the imaging system, the imaging facilities are barely functioning at this point, and we saw it unfolding one by one. I remember reading, I think in the end of 2024, how in one of the hospitals, I think there was the last CT machine that broke because they overused it. Because, you need the adequate amount of equipment. It could only take as many as the certain amount of usage time per day. And then when you overuse it, it just collapsed. So I think when we come to diagnostic, again, you said this branch is missing the imaging, the lab tests. Also to rebuild the system, and again, we keep on talking in PHRI a lot about the cascading effect. In our report last summer, that talked about the destruction of the conditions of life. Because you cannot rebuild the civilian infrastructure whenever over the half of the population is living in tents next to the dumpsters full of waste. They're breathing the polluted air. There is no drinking water. So the diseases are naturally, coming one by one. Even if you take the most clean and amazing environment in the world, people still are going to get sick. This is life. But whenever people are living in those horrible conditions for several years in a row, obviously their health is not going to be any better. So whenever we're speaking about the healthcare facilities, we cannot detach ourselves from all this situation that's happening with the population, because they are going to use and to need the healthcare system more than in the ordinary conditions.
So we're looking at a situation where there's a very dysfunctional system of sorts that is missing many of its components and is not able to rebuild and is not able to restock to the extent that it needs, in not good sanitary conditions, with rubble around the population living there, with a community that's living after almost 3 years of lack of adequate access to nutrition, drinking water, and sanitation, and everything else that is basic to human survival. And I think, now we have a bit of an idea of sort of the situation we're looking at, although I assume many of our listeners are already familiar with some of these issues. So now that we know this is the set of circumstances we're looking at, what possible ways exist in your experience and work to address this situation? Or in other words, what can be done to ensure that patients in Gaza, or just people in Gaza, have access to the medical treatment that they need?
Well, that's a great question, but I think that it all comes to the situation where Gaza has been disconnected from its healthcare system. If you think about the how it was supposed to be, right? If we go a little bit back in time to the Oslo times, and that a little bit explains why are we in the situation today. Because basically East Jerusalem was supposed to be sort of a center for the entire Palestinian state healthcare, right? So the specialized hospitals were supposed to be there, which in a way would have made sense, right? Because usually anywhere in the world you have the specialized care somewhat in the center. So in this case, this is what it was supposed to be, and no one thought, at least maybe a lot of people didn't think back then, that, after the series of unfortunate events that led us to this day, Gaza would experience such such an isolation, because they suffered for such a long time from, not receiving care, being dependent on medical evacuations. And it's kind of preposterous even to say, to call bringing Palestinians from Gaza to East Jerusalem, which is, also the Palestinian system, the healthcare system in East Jerusalem is Palestinian healthcare. So we call it medical evacuations, although it's quite weird to call it this way, because it's merely, asking for the permission for the Palestinian population to use their own healthcare, which is a rather weird situation, if you look at how it was supposed to be.
So if we just take a step back for the sake of our listeners, before October 2023, Palestinian patients from Gaza who needed certain kind of specialized medical care that wasn't available in Gaza but was available in East Jerusalem, how did that process look for them? How did they go about accessing that treatment?
So, right, that's a good opportunity to explain it a little bit. Well, again, the isolation turned Gaza into a place that's completely dependent on the external circumstances and conditions in order to receive the health care. Just before I speak about the treatment in East Jerusalem, it's worth mentioning that it was also very hard for them to build a specialized medical care inside of Gaza, because again, it's not like they could, just simply order their equipment from AliExpress and get it delivered right to Gaza. It's impossible. They needed the permission from Israel for any spare part that entered the premises of Gaza. So, of course, a lot of those points, together with, the medical equipment and medicine also needed permits to enter. There were always shortages, because in case you need something right now, you cannot just get it. You need the equipment to work alongside the medicine and all this stuff. So this is why they were not able to build it inside, so therefore they needed the specialized care outside. Then the permit system became, unfortunately, a part of the healthcare process. So if a person in Gaza needed let's say, some sort of chemotherapy that was not available in Gaza, they needed to get a referral from the doctor. They needed to get a bunch of documents, go with it to Israel, ask for the permit. This permit was not given right away, right? So, for example, if you had an appointment through your hospital in East Jerusalem for, August 5th, you were at risk to get your permit on August 7th, and then you would miss your appointment. So you had to start it all over again. All of this together with being severely sick. So we heard about a lot of horrible stories, including the stories when, one would receive the permit after they deceased already, and, this type of stories.
When I first joined PHRI, this was still a major project of our Occupied Palestinian Territory Department. It was accompanying patients through the permit process, especially those who had experienced refusals. And an issue that I remember vividly that they were tackling was these sometimes refusals for parents of children to accompany them to treatment in hospitals. In a way that meant that the children couldn't go, or that they had to go with an aunt or somebody from the extended family, a grandmother, when anybody who has a child knows how painful that is for everyone involved. A child needs their parents with them when they're undergoing medical treatment in a scary new environment, in a place that is far away and detached. And it's just one humanizing, very, very, very sad component of the imperfect system that existed before October 2023, but which is now something that we are demanding at the very least be reinstated. So we know that rehabilitation of Gaza's own healthcare system is not underway to the way that we want to see it. We know that equipment is being prevented from entering, as you said, and that doctors do not have the equipment they need there, both at the level of gauze and at the level of access to CT scanners. So I want to now jump into the main topic of this conversation, which is this campaign demanding the reopening of the, as you said, incorrectly called medical evacuation corridor from Gaza to the West Bank and East Jerusalem. So what exactly are we doing there? What are we trying to achieve? How are we doing it? How do you see this project?
Yeah, well, it's very good that everything you mentioned is very on point. I think that one of the most important points to mention before we speak about specifically the humanitarian corridor between Gaza and the West Bank, including East Jerusalem, is that what are basically the options? Because, I first of all think that this is it feels really weird in a way that we're asking to reinstate something that was already so problematic. And, for years and different organizations, from what I hear, people were really hoping that this system will become better, that it would improve, that there would be way more free movement for the patients, but instead we found ourselves in this impossible position where we have to advocate for something that was so imperfect. So in terms of the options of the patients, as we already mentioned, the healthcare in Gaza is not going to be any better unless, again, Israel lifts all the restrictions, and that's not anywhere to be seen. So one of the options that Israel is suggesting, and they're actually quite pushy about it, is to allow medical evacuations to the third countries. But unfortunately, we're seeing that this doesn't really work, because in order to evacuate each person, you need them to, first of all, make it on the list of WHO. Not everyone could make it to this list. They need to meet the criteria.
I'll just jump in and say, for those who don't know, WHO means the World Health Organization.
Yeah, right. Thank you. That's an excellent clarification. Because we're used to, to this vocabulary. So, in order to make it to this, list, you have to really get all the documents. You have to be able to travel. There are a lot of question marks on the way, and a lot of people might not even make it to this list. But even if you did, that doesn't mean that you're necessarily going anywhere anytime soon. There are thousands of people in this list. For the latest number that they published, I think it's about 18,500 people and more. It's a lot of people. And in, I think, fall 25, the number was 16 and a half. And before it was 15 and a half. So this list is just growing, and more people are going to get sick, plus people who didn't make it to the list. It doesn't make it any better for them, So each person needs to receive, a budget somewhere around the world. They have to be able to coordinate the transporting that person with their family. It's usually, I think, one companion and kids, in case families traveling with children. So all these people need to go somewhere for a very long treatment, possibly that needs, several courses of treatment, trauma patients if they need long rehabilitation. So the whole family is expected to travel. So that's not really a good option because, since the so-called ceasefire, I don't remember the specific number, but I think it's about 1,500 something people have left Gaza. While from what I saw from the Ministry of Health of Gaza, it's over 2,600 people injured for the same period of time. So you have basically, more injured than evacuated. Of course, we don't know what's the level of the injuries and all the details, but just the comparison, that this is how the ceasefire is treating Palestinians in Gaza.
Not to mention the fact that it's not only injuries, people who need acute or chronic disease. There are people on the list who are not trauma injuries. There are people who just have an illness that can't be treated in Gaza. So it's...
Exactly. And, you have a huge issue with, pregnancies that had issues and the infants who were born with health issues that cannot be addressed early. So, and we hear about all these cases all the time. So, unfortunately, it's only going to be more and more people. So, the bottom line, right now in Gaza, patients cannot get the healthcare facilities, healthcare inside of Gaza, and they cannot really travel to the third countries because, it can't happen fast enough to be relevant and efficient. So you are left right now with the third option, and which is the option that we suggest, is to reopen this, humanitarian corridor between Gaza and East Jerusalem, West Bank hospitals, which is very, very important. And we see it as, unfortunately, the only option. And I would also stress out, even if they do restock, which has to happen, it must happen, of all the healthcare facilities in Gaza, it's still not going to be enough. And it's still going to need this medical corridor because, again, as we mentioned before, even before October 7, they were really relying on this corridor.
So what are we doing as an organization to advance this corridor? And maybe if you can also say, what sort of response are our efforts getting?
Well, first, I would say that there are two main lines. There is the legal effort and the advocacy effort, both international and local. So in terms of the legal efforts, we submitted a petition with some partner organizations in November 25. And this is when we basically asked the court to help us to at least, to bring the state to this conversation, to see what does the state have to say, because, that wasn't much. We didn't hear a lot of constructive details from the state since October 23 on the subject. And so meanwhile it goes like this. There was, of course, the back and forth. The state said their opinion on it. We didn't hear a lot of unexpected points. Of course, they claim that this is the security issue. The issue of, that it's completely impossible right now to bring these patients. And they keep on insisting that the third country's evacuation is somewhat a palatable idea, despite the fact that we keep on saying, there are no third country evacuations that could support so many patients. So it's the back and forth situation. We were supposed to have a court hearing in the end of March, I think 30th, if I'm not mistaken. And what happened during the court hearing is that they said since there was still the war
with Iran,
it wasn't a good time to discuss such a matter, as if, the thousands of lives are not important enough to have at least a discussion about it. So they basically said, okay, we will have the hearing later. Meanwhile, the state had to submit their comment again, everything remains the same. They suggest the third countries evacuations. They do say that they will not reopen this humanitarian corridor. And right now we are preparing our response. So that's meanwhile what's going to happen.
I mean, there's so much more I would like to interrogate further here, both in terms of, I guess maybe one small follow-up question I'll ask before we sort of begin wrapping up this conversation is, has the state presented any evidence for this third country plan, any more developed plan, any statistics in terms of how many patients can and are being evacuated to other countries? Do they have arrangements with other countries that are ready to go as far as the state is concerned, the Israeli state?
Well, I mean, that's the same numbers that we're all seeing. That, I don't know, I think it's just the way of looking at it. I guess, like, Israel is looking at these numbers as sufficient. We're looking at them as insufficient. We're looking at it as, families, real people who are standing behind these numbers. Because, each person waiting every day, whenever you don't have the care for your child, for yourself, even if you don't make it to the list, but you, let's say, God forbid, lost a limb, you cannot provide for your family, and you cannot help your family. And this is the situation for so many people when you imagine the daily life in a tent in those horrible conditions. It's already terrifying to think of this. Mm-hmm. And then you have to do all this with a terrible disease or with a chronic disease without even such a thing as insulin, that's always missing, or without a limb. I can barely imagine this situation. This is really, really scary. So when we're trying to empathize on the urgency of how important it all is, this is exactly what we mean. We mean that these are people. These are thousands of people, families who are impacted by it, and this has to happen now. And the situation is not getting any better for them, unfortunately.
Yeah, I think anybody who's ever had to come into any contact with the healthcare system knows how difficult and unsettling moments of health crisis are in a person's life, and trying to imagine oneself living through that without the services you need and with every avenue for the services being blocked while people are watching their children die or suffer terribly or are suffering themselves. It's just beyond a low point that I could never imagine we would reach here. So the situation is clear from how we see it. The demand is clear. We're asking to reestablish something that is not in itself even the full solution, but can offer a solution for many people at least, in a setting, by the way, that is culturally familiar to them, with people who speak the same language and are of the same people. How do you see, just a last question to sum up this conversation, how do you see this effort playing out? What do you think is going to happen? And if it doesn't work out, what do you think we'll see happening in Gaza? What options remain for patients there?
Well, as we've said right now, and I think this is the saddest part, that there are no more options. That if this is not going to happen, if this medical corridor is not going to be reopened, we know for sure that there are going to be a lot of deaths. And this is, I always feel like it sounds almost dramatic to say it, but this is not, it's not just such an idea we're entertaining ourselves with or adding it as a dramatic effect. If someone has cancer and they don't get any therapy, any chemotherapy or the surgery they need, this patient is going to die die a horrible death, slow, painful, and, the way no one deserves. And the same goes to people who are going to suffer horrible trauma, horrible consequences if they don't get rehabilitated, people who wouldn't be able to participate in life anymore. And this is exactly what's going to happen. So unfortunately, I cannot predict what's going to happen in terms of this case, in terms of legal effort, or unfortunately, I don't feel a lot of optimism because we have some experience with the courts, us in PHRI and a lot of our partners. And unfortunately, we know how do they observe the cases of the Palestinian, like any Palestinian related cases. We unfortunately cannot mention a lot of success. And of course, we hope for the international advocacy, for all those channels to lead us to some good outcome. But again, we've been on this subject for a very long time, and unfortunately, until now, nothing's happening, you know.
Wow. Thank you for this very sobering conversation. I do hope that some of our efforts, you touched briefly on, efforts to mobilize the international community to join this demand, our international advocacy work, our local advocacy, our court work. I hope some of it comes together to get out at least some of the patients who so desperately need service. And I think one last thought I'll share before I'll say thank you for this conversation is that this is a reminder of why we kind of scoff at the idea of a ceasefire, because not only are the attacks continuing regularly, less frequently, less heavily than before, but regularly, people in Gaza are facing much the same conditions as they were in October 2025, with, yes, less frequent bombings. In some ways, things have worsened since then, and rehabilitation, as you say, is not underway. And we will see the excess deaths growing as long as nothing significant is changing. So it's a very disheartening reality to look in the face, but I think it can also be a call to action for anybody with any sway in this arena to understand the urgency of the situation.
Exactly. I'll just like to add, and for whoever is listening and wondering, what should be done, and we keep on it's a puzzling question because you want to say there is the magic remedy and I can just give you a list of what exactly to do and then things would get better. But I think this is very important to keep on reading, keep on learning about Gaza, keep on getting the updates. And of course, we don't need some more horrible things to happen in order to advocate for the re-establishing this medical corridor, for restocking the healthcare, because right now the bad thing is happening, thousands of people are suffering, are dying as we're speaking, and this is what should be the most important point in our focus.
That was a very apt conclusion. Thank you for being so clear in how you think about this and for this very thought-provoking conversation about how we should really be looking at this situation. Thank you to everyone who listened. If you found this interesting and informative, then please subscribe to our podcast or join our newsletter. You can do so on our website. And until next time on Diagnosing the Barriers.